Hi everyone, I'm Nicole. I'm a second year medical student with UQ-Ochsner, here today with Dr. Mike Duggan, who is a graduate of the class of 2022 and is currently in his pediatrics residency. Good morning, Mike.
Good morning.
So why don't we start with what made you choose UQ-Ochsner?
Yeah, so I thought that I hadn't heard of the opportunity towards the end of my application cycle and thought that the opportunity to be in two different places during those 4 years, especially one outside the United States, would offer a great opportunity for both my medical education and personal growth as well. And, I hadn't honestly even heard of the city Brisbane before applying, but when I saw it was in Australia and I could start in January of the next year, it was kind of a no-brainer to kind of get started with medical school and get to see what both Australia and New Orleans had to offer.
Yeah, and what would you say your favorite part of Brisbane was?
Favorite part of Brisbane, I was able to live in South Brisbane my both years and get to live pretty close to walking distance to all the restaurants and things down there, close to the river, close to a gym that a number of us joined, as well as not too far from the downtown area as well. So really just the outlook and the layout of the city was honestly really great and really inviting and easy to get around. And so that was probably my favorite part.
Yeah, me too. I love the South Brisbane area. It's really great to be able to walk after school and just get to be on the riverfront. What was your first thought that really drew you to pediatrics and you're like, yep, this is for me?
Yeah, so I think early on, my siblings and I, the pediatrician we went to, we always, it wasn't a chore to go, so to speak. And so just from an early age, definitely having that exposure was helpful. I worked a couple years at Mass General Hospital in Boston, where I'm from, a couple years after college, and got to really see a few different populations within pediatrics, children with autism spectrum disorder, childhood obesity, as well as a number of infant sleep studies. So just kind of seeing the different kind of vulnerabilities of that population and kind of what they're up against really collectively as a family was something that drew me to the area of pediatrics in general. And then that was kind of furthered in med school when you saw that children, despite maybe needing a reason to be in the hospital, were able to still regain and get back to their full health once they were back to their baseline and able to be discharged. And then personally, both my parents and my dad's father, my grandpa, were pediatricians as well. So definitely had some early influence there that kind of guided me in this direction.
That's so great. Do you think you have any potential of going into the family business with everybody when you're done residency?
Not exactly, but I am applying for pediatric gastroenterology right now for fellowship, which is the practice or specialty my dad chose as well. So I am being a little bit of a copycat to say the least.
Well, I'd love to hear more about that and how you're going down that path in a few minutes. But why don't we talk about what you think people think pediatricians do all day, but totally miss the mark on?
Okay, that's a great question. I think, it's been pretty highlighted in the news, over the last 5-6 months, things regarding preventative care, specifically around vaccines, is kind of a big point in the news right now, and as it should be. And in all honesty, is kind of affecting our day to day in terms of just our conversations with families. But it is right in the sense where preventative care is a huge part of what we do, and probably the most important part of what we do, especially in the outpatient setting. But there's certainly a variety of illnesses and presentations and more intense level of care that happens inside the hospital as well. Here at UCLA, where I'm a third-year resident, we have a number of children in the pediatric ICU, some of whom have been there for 3 days, some of whom have been there for 3 to 6 months. With, again, a variety of issues. Usually we're relating to kind of chronic issues, underlying genetic conditions that make them more prone and susceptible to infections that an immunocompetent person would otherwise be okay to fight off. But there's certainly definitely diversity in the patients that we see, both medically and socially. And it's always, as I kind of mentioned before, an all-inclusive treating the patient, but also, the family is also heavily involved too. So there are a lot of components to the care that make pediatrics really interesting to me. And certainly communication and conversations with family is one of the biggest things we do. And it comes down to vaccines as well, which we obviously highly encourage despite some other rhetoric out there, but also, there's a lot of treatment we do inside the hospital too. That's really important.
Yeah. Would you say that when you have to have all these tough conversations with both your pediatric patients and their families when it comes to preventative care and also chronic care management, that school really helped you develop the communication skills to be able to have those conversations, especially with things like vaccine hesitancy nowadays?
Yeah, absolutely. I think it was from what I remember in my pediatric rotations at Ochsner, certainly a lot around shared decision making. And, obviously this is a group decision, and it gets hard as the children get older and want to make their own decisions. But, it's ultimately going to be most successful if everyone's on board, their caregivers, parents, typically the provider as well. And so I think that, definitely learned a lot seeing different viewpoints that people come from when they present to the hospital, and kind of working along that and meeting them where they're at, so that again, it's the most successful and safe outcome for the child or for the patient. And Ochsner definitely prepared me for that with the volume of patients that we saw.
Yeah, that's great. So with the pediatric rotation, how many patients would you say you think you saw in like a week?
It's a great question. It's been a few years now. Certainly thinking back to like my fourth year as a sub-I, we certainly were carrying somewhere between 3 to 4 to 5 patients with a variety of presentations, and definitely always felt really supported by the resident group there. The hospitals there were really great. So it was definitely a great educational experience to have there. Certainly in the emergency department, both at the main campus in Ochsner, but also a smaller one, I believe, in St. Charles. You also kind of saw the difference of how you treat patients when they're already at the main medical center versus when is the time to kind of transfer and make sure that the higher level of care is found. So definitely the team seemed to be, from what I remember, maybe like 16 to 20 patients inpatient. I know they're in the process of building a new children's hospital there, which will obviously be great once it's finished. But that was kind of my experience.
Wow. Okay. That's a lot of patients every day, especially as a med student. Do you think there's any like skills or personality traits that really helped you be a good fit for this field or for other students that would help them kind of lean towards pediatrics?
Yeah, I think I'd like to think I'm a decent listener and able to kind of have empathy towards families in the situation that they're in, and kind of, as we were just talking about, people come with different viewpoints and different levels of understanding with things. And I think the ability to be an educator while also having some patience are also two important traits also with pediatrics, just because sometimes it takes families sometimes to come to terms with what's going on. It's obviously a pretty emotionally charged situation often, especially for children who are receiving a more severe or lifelong diagnosis. And so really being a good listener and communicator with families, as well as educating them, and kind of like maybe going against Dr. Google at sometimes is kind of helpful to really kind of make sure, again, that the child's being taken care of appropriately.
When it comes to matching and being competitive, how would you say the experience was for matching into pediatrics, and how did you prepare for the match process?
Yeah, so pediatrics compared to some of the surgical subspecialties certainly doesn't have the same level of competitiveness where people are not matching at such a high percent. But that being said, still matching at a reputable institution or institution where has varying levels of care and is a site where they have level 4 PICU, NICU, and places where you're going to kind of see a breadth of patients can definitely be on a bit more competitive side. I thought that Ochsner did a great job of throughout, especially the 3rd and 4th year when you're doing rotations and in the process of applying, a great job of balancing, having optimism and encouraging students to shoot for the stars, so to say, or, aim big, but also being realistic with where they were. And certainly being an international med grad still for some programs and subspecialties can carry a certain tag. I think it's less so with pediatrics, and certainly in my own class and classes below me, Out of the 28 categorical spots we've had, 3 to 4 have been IMGs, whether it's from Israel or Caribbean. No other Ochners yet, but maybe we'll get there soon as well. And so I think that tag didn't like scare me away from peds, and I was never worried about not matching. It was just a matter of, will I get phased out from some of the more well-known programs due to the IMG status.
Mm-hmm. When you were applying, did you feel like you had like a lot of different diversity in your application when it came to having a very long CV, or did you feel like you focused more on like a few specific things that were really interesting to you and like something you were very passionate about and went that route? Or how would you recommend for other students to prepare for that type of match application?
Yeah, it's a great question. And having just recently completed this same ERAS application for fellowship now, I think for both cases, what remains true is you want to be able to tell a story, something that's kind of representative of who you are. And so in terms of advice and in terms of what I did, I just definitely advise you to not just do a bunch of sporadic things that, line up to 20 different things, but a few core things that you're really passionate about and can show like a pretty long-standing commitment to, or, obviously things get busy, and especially with our program where you switch between the second and third year, it can be difficult sometimes to have those long-standing relationships and like commitments to certain programs. But that being said, whatever you do get involved with, try to get involved with it into a higher degree, into a leadership position, and not just a member if you can. But at the same time, they can see if you've spread yourself too thin and everything's been superficial. So for me personally, I was most involved with the outreach opportunities at Ochsner in New Orleans, and was part of OMSA as the outreach officer my third and fourth year. And so that was a lot of fun to coordinate the different different projects, I should say, that were taking place in New Orleans. And Habitat for Humanity was definitely my favorite amongst those. Okay. And then I was also part of a more national nonprofit called Medicine in Motion that was focused on mitigating physician burnout amongst providers, as well as increasing philanthropy and community activity as well. I think there's still an active chapter. I could be wrong on that, but certainly there still are some in the country, which has been great to see. And so I think those were like kind of the two big things that I focused on: the outreach and the physical activity, fitness, anti-burnout perspective, and kind of showed that both with things I'm passionate about personally outside of medicine too. So just again, trying to tell a story that's representative of who you are.
Yeah, that's great. Thank you. Would you mind maybe going into then now your match story, where you applied, what you were kind of hoping for, and how you felt on the day of with coming to match?
Yeah. So for me, the draw to come to Southern California was my mom grew up here only until she was 6 or so. But, we've always had family out here, and we come every few summers, and it just seemed like a great place to live year round. And so, my great aunt, who just passed last January when I was here, actually at 101, so lived a long, full life, was a house that we'd always come and go and visit. And so we just always had fond memories. So the goal to come out here and at least live here part of my life was definitely always in the back of my mind, starting medical school. And my sister also went to UCLA for undergrad, and we overlapped for a couple months when I started here too. So I had some family ties to come out, and also someone who loves the outdoors. Just really wanted to be here and experiencing that. So from a location standpoint, which honestly at the end of the day, like in my opinion, is probably the most important thing, just because in a very good way, the ACGME really is great at standardizing the requirements that you have to complete, or things you have to check off before graduating. And so there is a lot of similarities and overlaps amongst the programs. So definitely being somewhere where you feel like you'll be happiest, have a good social support system, are things to aim for. And again, this is coming from peds, where it's like maybe there's a little bit more of some choice there versus sometimes with the more competitive specialties, you got to take what you can get. Absolutely. Yeah. And so from what I remember, definitely a good number of interviews, some Zoom fatigue in there, but you get through it. And it was good to apply somewhat broadly, but also, definitely not overdo it either, because again, you want to make sure you're kind of ready to interview for the ones that you or care about the most, just because I think typically most places have a pretty good emphasis on the interview as a part of your overall application. And then, I took advantage of us graduating in November and having the time off before starting, which was a nice break in general. And so match day itself, I was with my family in Colorado skiing. And while my dad and sister took a run, I opened up the email and couldn't believe my eyes. Honestly, I had to triple check, and then got to celebrate that with them once they were down. So it was a great day.
That's a great MASH story. Skiing on a mountain to open it. That's a really cool story. Maybe I might have to do the same thing. That sounds great. When it came to the interviews, obviously you just said a lot of it was online, and I think they've really maintained that for nowadays. Do you feel like you could still get a good picture from current residents on what your work-life balance would be like and what a typical day would be with residency that way? Or did you kind of take advantage of the break and go out and really see where the area would be like?
Yeah, that's a great question. I did live out here a couple months before starting, just again taking advantage of the time we had off. Okay. And again, my sister, it was just kind of there was a little bit of a tie to do so. I had a really great conversation with someone before my interview itself. It was actually a rising chief now, and it was a mutual friend through a college study abroad. And that was a really helpful conversation. Typically, though, a lot of these places are really great at having, resident Zoom socials, and most people offer their contact information. So my advice would be, if you feel like you've been connected with someone slightly, to take advantage of that and just, have a call off to the side 15, 20 minutes to answer those kind of burning questions that you have and really get the full scoop. I think we, at least I would like to say, are pretty honest in those social resident socials, and even the ones that are official with their programs, of kind of saying it how it is, the good and the bad and the ugly. And luckily out here, I'd definitely say it's mostly the good, but certainly having those one-on-one conversations too are a great way to know about the ins and outs of certain programs and make it easier when it comes time to ranking, assess how well you feel about the program.
Right. That's a great idea. Thank you. Would you say there were what are a few things that Ochsner really helped you set yourself up for success with the match?
Yeah, I think, again, as I mentioned, I really think it's a good balance of, encouraging you, saying, if you're in a good spot, really being definitely aim for as high as you want. And I think that they did a good job with the mock interview piece, and also making sure your resume and personal statement were in a fair spot as well. So I definitely felt like we were being led and not off to figure it out by ourselves. And so, it's at the same time, it's how much you put into it too. So I think it was a good balance of feeling like we had that support, and definitely people to ask questions to for things we were concerned about, while also kind of taking some ownership ourselves. I remember the timeline of things, I never felt too rushed. And I think that they did a great job of introducing things to us at appropriate times, when not at the beginning. At the beginning of third year, I remember a timeline being drawn out, and it wasn't tomorrow start making a rank list. It was very stepwise, and I think it made a lot of sense and was appropriate in that way.
Okay, that's great to hear about that. I'm going there next year, so obviously we're just trying to see how to best prepare and understand what rotations will be like compared to now. Fortunately, we've had a lot of general practice exposure this year, so it's been really great, but it's good to hear that there's more support next year. With that, we have heard also about the sub-internship, and could you maybe kind of explain, if you did yours at Ochsner, or if there are opportunities to perhaps do it at a place you'd like to do your rotation or your residency at, excuse me.
Yeah, I did all of mine at Ochsner. I think in pediatrics, it isn't quite emphasized as much. It's definitely still an important thing to do, and wise to look into if there's a specific place you have in mind. And with me kind of applying in 2022, there was still some kind of questionable how do I say this? Like, not regulations. There is a certain, the COVID stuff was still like, we weren't so far removed. And so anything again attached with being an international medical student implied maybe not being physically in the US, which obviously isn't our case.
Mm-hmm.
And so it was just difficult to get those. I can't remember off the top of my mind anyone who actually was successful from a peds perspective. And I think it was rather limited. Obviously now 5 years out, it's hopefully a little bit of a different story. But that being said, I think the main focus of those sub-I should be the strength of those letters. And hopefully, typically that's an attending or two who you've already had the opportunity to meet through those third year rotations. It doesn't always work out that way. Obviously, schedules are always different. But I think that can be a helpful mindset to have, of like really thinking about that letter and thinking how well are these people going to know me versus going off somewhere and kind of starting brand new. That being said, I don't think that's a mistake either, especially if you have a certain place in mind. But I definitely think Ochsner provides more than a great experience as a sub-I to really demonstrate your skill set and be able to see, again, a pretty complex population.
That's great. Thank you. I would like to move on to just understanding what residency is like for you. Obviously, you're in your third year, so hopefully it's a bit more relaxed compared to the first year. But could you maybe walk us through a day-to-day as a pediatric resident?
Yeah, so we do rotate through 4 different hospitals at UCLA, main campus in Westwood, Santa Monica, and then a county hospital up in Sylmar called Alum, as well as Long Beach Memorial Care, a little bit south of us as well. And so typically if you're on the inpatient side, we're pre-charting from 6 to 8, rounding from 8 to 10, 10:30, and then advancing care for patients through consults, discharges, waiting for new admissions as well until noon conference around noon, 12:15. We have about an hour of protected time there, or at least somewhat, and are able to tune into the talk of the day, typically given by an attending or fellow physician in person on the 5th floor of our hospital. And then as the afternoon comes around, following up on the recommendations of these consults, as well as, again, just moving beds with admissions, discharges, as well as transfers from outside hospitals. Day typically wraps up around 5:30, and then handing off to the night team and signing out to them so that we can do it all again the next day. But typically that's kind of the rundown of an inpatient day for us at UCLA.
Okay. Sounds like a nice kind of flow. What are some of the topics that you guys discussed during your lunch hour talk?
Yeah, that's a great question. There really is some variety, and typically it'll be whatever specialist is, we're featuring. They can range if it's an endocrinologist talking about management of diabetic ketoacidosis, if it's a PICU attending kind of the workup for higher levels of care of respiratory failure. We've also had some great resident-led talks. Each year, we've kind of had a theme related to advocacy. Last year, it was primarily focused on mental health. This year, especially being in California and more so Los Angeles, focusing really on immigrant health, since that's a good percentage of our patients here as well. And what we can do basically as pediatricians in the outpatient setting in terms of making sure our patients feel safe and secure, as well as directing them towards resources that can be helpful, especially in these kind of difficult times that the patients are facing. So there's a good variety of different subspecialty talks, while also some consistent themes throughout the year.
Yeah. That's great to hear that there's a bit of a mix of like some of the themes that we see at Ochsner too, which is like competent, compassionate care. It's really exciting to hear. And then you mentioned that this was just kind of your inpatient day. Do you have rotations throughout residency where you'll be in outpatient care as well, or is it primarily just inpatient?
Yeah, so we have the X+Y schedule, which I think is becoming more and more popular. But every 5th week, we have a week of clinic. And myself, I'm at a federal qualified health center in Santa Monica, Venice area that we primarily see patients who have Medi-Cal insurance, a lot of immigrant health as well. And so we try our best to have continuity there. Sometimes it's easier said than done, but there's certainly some patients who I've seen throughout my last 2 and some odd years here that it's been great to build relationships with and focus on preventative care, vaccines, making sure that we're having a balanced nutritional diet as much as possible. A part I like about the clinic is once a week is our fit clinic, in which patients who are overweight or obese have the option to meet with the physicians, but also a nutritionist and behavioral health specialist as well, and kind of provide more multidisciplinary comprehensive care. And that's been really great to see some patients make some progress in that area, and largely due to the fit clinic and the help they have there. So that's been primarily my outpatient setting experience.
Wow, that sounds really great. It's definitely something that seems more up my alley. So hopefully I get to experience something like that. But how would you say the intensity of the job is balanced? Like, are you able to have a decent work-life balance with your long inpatient days, or is it a bit trickier right now?
Yeah, so I think, it's all about expectations. I think I definitely came in expecting to work like a lot, and certainly like hour wise, that those numbers kind of were there. We certainly are very appropriate in terms of not going even close to the 80 allotted hours per week. But certainly like we do have to work 24-hour shifts at a few of the hospitals that we're at. But UCLA really nicely, not only do you get the rest of the day off in which you've just worked, but the following day off. So I think it's all been honestly reasonable. Certainly there's some stretches in the ICU where it's a bit of an earlier start, some longer days, some more intense days as well, where those can be a bit draining. But luckily for us, it's every 2 weeks or so that we switch rotations, which does have the effect of like feeling like you're settling in and then everything changes. But also for things like nights and ICU rotations, it's not for a full month. And so it's kind of more achievable in that way.
How did you come about deciding to apply to gastroenterology for fellowship compared to some of the other options that you can go into?
Yeah, so I felt like at first for pediatrics, I was definitely drawn to preventative care, primary care, honestly, with the big focus on nutrition and physical activity. That had been childhood obesity, like my original thing that I was most interested in and had gotten some exposure to during my time at MGH those 2 years.
Mm-hmm.
But then when I was inpatient, just for my normal rotations, I kind of recognized I liked that side of things as well. And I also, through a friend who had ulcerative colitis and another cousin who had to have a colostomy bag after stage 3 colon cancer, I saw these GI illnesses as something that were pretty serious as well, but also things that if treated pretty well can allow people to live a high quality life. And between that and a number of patients with inflammatory bowel disease, liver transplant, even things like constipation and feeding intolerance, which some people may not enjoy as much, or the disorders of the brain gut access. I definitely found that there was a lot of variety of patient presentations and kind of, again, like a very large range of patient presentations and severity of illness that was interesting and would allow me to work both in clinic and also inpatient, while also performing procedures such as endoscopies, colonoscopies, that would kind of just make every week a fun week and kind of add some variety to, and not just do the same thing day in and day out.
Yeah. So with gastroenterology specifically, do you have a big mixture of, you'll have patients where you only see them like once or twice, or you have a lot more of like continuity of care with the field, or is it a bit kind of in the middle?
Yeah, so certainly in the outpatient setting for patients that have had that liver transplant or do have inflammatory bowel disease, there's a lot of monitoring over time, namely with labs and exam and imaging as well. So that's definitely where you see a good number of continuity, and it's, if the patient's doing okay, not like every month or anything like that. Whereas for GI inpatient, sometimes with that initial diagnosis of IBD or things that have just come up for the first time, you kind of see them in that setting, and then they might go elsewhere for their outpatient care. Again, just kind of the different types of hospitals that we go to kind of lead us down that way as well. But in general, I do think it's a specialty that has a good good amount of continuity, just given that a lot of the illnesses can be chronic. Hopefully with things like constipation and issues with failure to thrive, some of those are worked up early enough on that the visits are really spaced out over time. But there are definitely some patients that do require some rather frequent surveillance for their illnesses with the gastroenterologist.
Yeah, very interesting. I don't know much about gastroenterology, so it's been really great to learn. Do you have anything that you want to impart on current medical students about the field of pediatrics that you know now and kind of wish you knew as a medical student?
Yeah, I will try and be positive. I think it should be looked into more. It's been a little disheartening the last couple of years, just with some medical schools around here. I know I've had just 0 or 2 medical students going into pediatrics at all. So I really hope that medical students do a even better job than they have been, are really exposing medical students to the field of peds before, or I shouldn't say before, but during their time in medical school.
Mm-hmm.
And, there's a lot to gain from being in the field. I think it's really rewarding what we do on a day-to-day basis. And it's like I spoke about a bit earlier, there's really nothing better than getting to discharge a child home and just knowing that they're going to be running around and happy along with their friends, and not as much as maybe some of the adult patients who are kind of so chronically ill that their quality of life isn't quite as high as a child's can be. And at the same time, there are a lot of chronic kids in pediatrics as well, who you just kind of have to reframe your mind of what's a meaningful life for them as well. And obviously, as long as it aligns in the goals of the parents and the family, that's an area that we can be of help as well. And then just again, with the preventative care things, we're obviously in a different time in our society right now when it comes to getting vaccines and kind of doing what the normal things are, but really getting to be that educator and communicator with families and help them make those decisions to protect their child and their families is an important role as well. So definitely think it should be considered more amongst medical students, and just giving it a chance and seeing how they like it.
Yeah, thank you. And just 1 or 2 more questions just to kind of wrap it up. Do you have any standout moments or mentors that you had in med school that really have stuck with you since?
Yeah, I would say the 2 that come to mind. Three that come to mind for me. 2 of whom wrote 2 of my letters of recommendation, and one of whom is a longtime peds hemonc doctor, Dr. Warrior, who is really involved with our journal club and pediatric interest group at Ochsner, have really been supportive and also really inspiring in terms of their own work and encouragement to go into pediatrics. And so definitely having those mentors is really important no matter what field you go into. But certainly I thought Ochsner, especially with the amount of hospitalists that were there, were all really, really great educators and really made peds a fun experience. So certainly there were probably more than I can think of at the top of my head, but those who wrote my letters as well as Dr. Warrior were really great.
That's great. I look forward to meeting him next year. And then last one, we know we're talking about you going into peds gastroenterology. Do you have any future career goals within the specialty or just as a pediatrician as a whole?
Yeah, I'm definitely still trying to figure that out. A point of emphasis I'm trying to work on as a resident right now is providing more education for medical students and residents along nutrition, something that we don't get a lot of proper instruction on, and it's not really, as you probably have realized with step 1 on board exams, besides pretty rare vitamin deficiencies that might only affect a small subset of the population, and less so on the day-to-day and providing support and education for our families. And so I'd like to kind of see that area of medical education advanced while I'm an attending, and trying to kind of push that forward as much as possible would be an interest of mine. And then also have always had an interest towards global health as well. we'll be going to Mozambique in January for a month, and just definitely looking forward to that experience and looking forward to working with a UCLA attending who lives there year round, and getting exposed to the different types of issues that they see, specifically with malnutrition. So global health and nutrition, I would say, are two of my most important interests right now.
Wow. Well, thank you so much. That sounds like a great opportunity for you in January. And always appreciate getting to hear about more pediatricians taking an effort for global health. I think that is all we have for our interview today. Thank you so much to Dr. Mike Duggan for kind of enlightening us.
Nice to meet you, Nicole. Thank you.